Hello everyone, welcome to sqadia.com, and in this section of the lecture topic Benign Lesions of the Uterus, we will talk about some surgical managements of the uterine fibroids. In this we will talk about myomectomy, embolotherapy and cervical fibroid management. Surgical management of fibroid uterus is surgery is myomectomy in which myomas are removed. Only the myomas which are formed by the excessive growth of the muscle tissue, they are removed. Uterus, fallopian tubes, nothing is removed, only the myomas are removed. Then myomectomy is by the laparotomy, in which the abdomen is open, or it can be done by laparoscopy, in which the laparoscope is inserted and then myomas are removed with the help of the laparoscope. So laparotomy, incision is given in the abdomen and then myomas are removed. Hysteroscopy, again, hystoscope is inserted into the uterus and then the myomas are removed. Another method of removal of uterine fibroids is embolotherapy. It can be myolysis, in which there is lysis or death of the myomas or muscle tissue, or it can be due to hysterectomy or removal of the uterus. Myomectomy, in this diagram, if you see, these are the myomas. So in this, just the myomas are removed. Here, nothing else is disturbed. Myomas which are present, they are removed surgically with the instrument inserted, and myomas are removed. Myomectomy. This is the hysteroscopy, the picture you get after the hysteroscopy, and you can see the growth with the help of the hysteroscope. So hysteroscopy. This is laparoscopy. Laparoscope is inserted and these are the growths or fibroids present, and they are removed with the help of laparoscopy. Visualized directly with the laparoscope and then removed. Embolotherapy is another method. These are the fibroid. In these, the catheter is inserted, angiographic catheter, and then in embolotherapy is basically it's a technique in which the blood supply is affected or reduced, that can cause the necrosis or death or shrinking of the fibroids. Cervical fibroid, this is the picture of cervical fibroid. This is the body of the uterus. Then there is elongated cervix, vagina, and this is the fibroid present in the cervix. So thank you for watching sqadia.com.